All right, perfect. For the dial tone. All right. Oops. All right.
You ready?
Yep.
All right. Well, good afternoon, everyone. Welcome to the Senior Dental Advisory Committee. We'll go ahead and do introductions. My name is Todd Coffey. I'm going to fill in for Linda today. She's not able to make it. Go around the room.
I'm Joan Eskins with Tri-County Health Department Dental Clinic.
I'm Glenn Pfeiffer, retired jeweler.
I'm Juan Johnson, CU School of Dental Medicine.
Luke Johnson, Inner City Health Center.
All right. So people on the phone, can we do an introduction again on the individuals on the phone?
Let's do a couple.
Yeah, this is Whitney Jansen Pankratz, Wells County Area Agency on Aging. I do our dental, vision, and hearing voucher program.
Was there one more person on the phone?
Dr. Lavery at Marillac in Grand Junction.
All right. So for people on the phone, Chandra mentioned that this is a cell phone, so we'll try to talk loudly, but let us know if you're having trouble hearing any of the comments during the meeting. So the first point on the agenda is to go over the minutes. Has people had time to review the minutes? And I guess before we make a motion, do we have a quorum?
We do have a quorum.
Any comments on the minutes?
Move for approved minutes.
Second.
It's been seconded. I think no comments. Motion will pass. We'll go on to the first agenda item to go over the additional information that we requested from the last meeting. Chandra, are you handling that?
I am handling that. So you can sit back and relax, Todd. So you're going to see two separate sheets. One of them is actually the initial sheet of what the committee asked for. Do you need some copies? There's a, oh, you got it. And then the other sheet is the info that was obtained from the grantees and also from Medicaid. So on the first one, D3221, we requested that we get more information on this one. It pretty much was 50-50 on this one coming back. In knowing this, we had half stating that they don't feel there was a reason to add this procedure code onto the procedures. And then the other half stating, yeah, we could use it. So at this point, with knowing that it was not close to 100% of asking for this procedure to be added, and with our current level of funds available at this time, the department is recommending that this does not go forward. On D3346, D3347, and D3348, the majority of the grantees feel that the retreatments are not warranted for root canals, and they would not recommend to put into the Schedule A. So the department is going with the grantees and would like to recommend also that these are not put on the current procedures. On D4346, this is one that I believe Joan had given some information on. And if you don't mind stating what we had talked about and then also your email to me.
Yeah, you'll have to remind me about the email, but I feel like this code would be fine to be added on at this point if we want to do that. The reason that I recommended that it not go forward is that I have a bunch of information recommended by other people that said that there were all kinds of other things that had to be done before you could do this procedure, and I can't even remember what they all were, but they were crazy things like intraoral photos and all kinds of stuff. And the ADA doesn't recommend that, and the CDA doesn't recommend that either. But I just felt like we needed to put it forward. And I personally would never use this code because HCPF pays a whole lot more for a prophy than for this. So,
Okay.
but I think it would be fine for people who are requesting it.
Okay, thank you, Joan. And then also the guide to reporting D4346. This is what I received from Jennifer from Colorado Department CDA. So I just kind of put that in there for informational guides. As far as what I received, there was no recommendation either way. So once again, with the way funds are with us and there's not an overwhelming need for this procedure, I would suggest that we not move forward with adding it to the procedure guidelines. On code D9310, consultation, I did speak with Medicaid. They have used this code 22 times. And we had a really good example that came in from one of the grantees, so I threw that in there. And the example that was given was Dentist A and Clinic A did an initial exam, which they were paid a D0150, but wanted to get a second opinion about a periodontal condition. So Dentist A sends patient to Dentist B and Clinic B. So it's a completely separate clinic and a different dentist. So Dentist B uses D9310 to provide the consultation second opinion for Dentist A. I didn't have any recommendation either way. I can tell you in the past, we've had some grantees that do not do, let's say, impacted teeth. So they will send them to someone else. And at this point, there's no way for those individuals to really get paid for the initial consultation because the D0150 has already been used. So this would be a way for that specialist to receive a payment for looking at the patient. And also, obviously, they would get paid for the work that they do. So we did not get in a recommendation either way, though, with this code. So I would leave it up to the committee on what you would like to do on D9310. On D9410, house call, all I received from everybody is we do not ever use this code. So I would recommend that this code is not put into the procedure guidelines. And let me get to where we're currently at because I'm really bad about, there we go. So that's all of them that the committee needed more information on. So I will let you all discuss on how you would like to move forward with the codes.
Are there any comments?
In regard to the 9310, you can always use the limit oral evaluation problem focus for evaluation if you want it.
Okay.
Fits into both of those. And actually, programs allowable fee for that is more than the consult.
Okay.
And that currently exists.
Yeah, I mean, on my little iteration of the fee schedule, I could be wrong, but it looks like it exists right now, and that they're paying $60.
Because that's D0140, correct?
Yeah.
Yeah.
That would be a way to code.
It would be cheaper to do it the other way.
It'd be cheaper to do the consult. Yeah, the way it's articulated here. It'd be cheaper.
Any other thoughts or comments on the phone? Are there any comments on any of the other codes? So I guess the question will be, do we want to vote on these individually? Do we want to vote on them based on the category they're in? What are people's preference?
I'm going to say actually just for record keeping, vote on them individually.
Okay. So starting at the top, do I have any motions for D3221?
I move we not approve it.
Second.
So it's been motioned and seconded to not approve D3221. Is there any discussion? Okay, all in favor?
Aye.
Any opposed? Okay, that will not be funded then. And D3346,
Move we not approve it.
is there a second?
Second.
Joan seconded. All right, any discussion? All right, all in favor?
Aye.
Opposed? Right, carries.
Are the people on the phone still with us?
No, we might not have.
Hello? Oh, I wonder if we lost them.
Here, I'll try and get online.
Thank you.
Don't we hold just a little bit?
How many do we need for
3,
quorum?
4, 5. We need them for quorum. Actually, we now have a quorum, so we can.
Sorry, GPS malfunction. I've been
Still having an instruction going on as well, too.
We haven't
I
moved.
apologize.
So we're having some difficulty with the phone system, and our cell phone, I think, let us down. So we have 2 individuals on the phone that have dropped off. With you, there's a quorum now. We're going through the document with the additional information that HICPA provided around the questions we had from last time.
Okay.
And we've voted on 2 of them, but we're not sure if people on the phone were involved in the vote. So we might want to hold off and either let you get up to speed or get them back on the phone.
So far, so you know, Mike, we, on D3221, it was decided not to pass. D3346, is that one that we decided not to pass? And then now we are on D3347.
But we never heard from the people on the phone on the first 2. So I just want to make sure that if you want to vote on those 2, then we have a quorum. We're trying to get them back on the phone.
I wonder if I should just hang up. You can hear me?
Okay. Hold on 1 second. I'm going to go ahead and disconnect yours. For some reason, we can't hear them.
It's called Sprint.
Okay, everybody can hear us through the phone now? Okay.
Yay.
Yes.
Okay, sorry about that, folks.
So for people on the phone, we had voted on D3221 and D3346. I'm not sure if any of you were able to hear that conversation.
Yes.
I could hear it.
Okay. Did you have any other vote? The vote was to not pass either of those 2?
I agree.
I agree also.
Okay.
I
All right.
agree also.
So we're unanimous then. And then we'll move on to D3347. The recommendation was to, from the department, was to not fund that, correct?
That is correct. The majority of the grantees felt that there was no need to have retreatments on root canals.
Any motion on that?
Move we not approve it.
Second.
Any discussion? Okay, all in favor?
Aye.
Any opposed? All right, that passes. And then D3348.
Move we not approve it.
Second.
Second. All right. Any discussion? Okay, all in favor?
Aye.
Opposed? That passes. And we'll move down to D4346.
I move that we not approve that.
I second.
Okay. Any discussion on that? All right, all in favor?
Aye.
Aye.
Opposed? So moved. And on the next page, for some of us, D9310. That one, Dr. Johnson pointed out that there's another code that can be used. That other code is more than twice as much as this code. So I don't know if that's a consideration for using this code or not.
Are some of the providers uncomfortable with using the D0140 code?
Actually, there are a couple, and I think that stems from when this was the OAP dental program before it got revamped and moved to us. So that is something that I will deal with on an individual basis when I receive a call from them.
Okay.
So.
Any
We not approve it.
second?
Second.
All right. All in favor?
Aye.
Opposed? Moved. And finally, D9410 for the house calls. Any motion on that one?
I move that we not approve that.
Okay. All in favor?
Aye.
Aye.
Any opposed? So moved. All right. So none of those were approved then, correct?
Correct.
One was.
Nope, none of them were.
No, none was approved.
None was.
All right. Guess at this point, do we have any public comment?
Nope.
All right. This is going to be a very short meeting.
It is. I do have a couple of updates I'd like to give you guys since we have plenty of time. I wanted to let you know that the ones that did pass at the previous meeting are going to the Medical Services Board Friday. And everything looks good. I shouldn't have any problems, and I don't look for it to be contentious because everybody wants to, you know, add those in. The other thing is we, as you know, the OHC, the Oral Health, what is it? Oral Health, is it committee? Colorado, maybe that's it. They went forward and they were lobbying for more money. It was refused. A lot of it has to do with we pay so much more than Medicaid. We are at an average of almost 80% more that we pay our grantees than Medicaid pays. And once that was realized, JBC was not comfortable giving us more money. So I just wanted to give you guys an update on that. We have spent approximately $2.3 million of our funds. We do have 2 grantees that are completely out of funds at this time. Contracts have been, those were actually sent out yesterday, I think it was. What is today? Tuesday, yesterday. Contracts were sent out for fiscal year 18-19. So those are in the process of being reviewed and signed and sent back. The other thing is we were approved by JBC. We had funds that came back in from the audits, and then also ones that are going through the state board for fraud. That funds were sent back to the department. We got an okay to spend those extra funds in fiscal year 18-19. So once we get into that fiscal year, I'll be able to let everybody know the amount of those funds that we'll be able to use for more seniors. So that'll be nice to have. I think those are all the updates. Does anybody have any questions?
So for the grantees for fiscal year 19, are there any new ones? Is there different geographic areas that are being covered?
There are no new ones. We do have ones that are pulled out of Denver. Couple of name changes. And I think what I'm going to do is go ahead, once I get everything set up for that shows our grantees by county. Once I get all that done, I will get that sent out to the committee so you can review to see who's in what counties. Both lower portions of the state, once again, we have nobody on both. It's just right in those lower corners. We have nobody there. So did it a little bit differently this year. I did put a mark next to names of grantees that say that, you know what, we'll do work on seniors that are in El Paso County. Well, that grantee may not be located in El Paso County. This year, I have put a mark stating that yes, they will take seniors from El Paso County, but they're not located in El Paso County. And that shows you that's huge because it looks like we have a lot of state coverage, and actually we don't, because a lot of seniors need to drive to get to where they need to go for that assistance. So.
I have a question. Should we entertain changing our schedule?
I was going to say the same thing.
You know,
Yeah, I mean, if we're
that is
high.
something that has to be changed through law. When Senator Kafalis did all of this, that was one of the main things is the current rates could not be lowered. So that is something that I will go ahead and talk and see what needs to happen to have that done. And see about, because, you know, we do have some that are over 100% more than what we pay Medicaid, or I'm sorry, what Medicaid pays. And to me, there's some that is just, you know, if I had one grantee that contacted me and said, we pay way too much for a lot of procedures. We have, I think our closest, and you ladies might remember, I think our closest ones were the dentures, correct?
Yeah.
And they were in the 20% that we pay over. And to me, that's a good, you know, that's a good amount. But when you start looking at 50 to 100% more, I mean, how many more seniors can we be helping? So I'm glad you brought that up. So I will definitely look into that and then follow up with an email to you all, letting you know.
I know that there's the budget items are going to be worked on starting in May. I don't know if this would fall into a budget item or if the department would have to try to carry a bill next year to open up the fee schedule.
I believe it'd have to be a bill.
Okay.
I will double check. But since that was put in by Senator Kafalis, it's not going to be an easy change. But to be honest, by what grantees have told me, what you all are saying, it's a warranted change. So
On the average, what do you think we are over? I know you said one was over 100% and one was 50, 60%, 70% on an average over, close to 80%.
Close to 80%. If you
So our
average,
argument would be that we could see maybe another 80% more patients or whatever that would end up being.
And I think it also depends on what percentage of those codes are being used. I mean, if it's only one procedure that's not being used very often, but what is it?
Yeah.
I mean, like Profees, you guys were paying $88 or whatever versus about 40 for Medicaid, 39 or whatever. So that's,
And then the other would be.
here it is.
Go ahead. Sorry.
I had sent out an email because this was brought up. And this basically is a synopsis of what everybody is paying as far as per area. So diagnostic, senior dental program averages 101% more than Medicaid. Preventative, we pay approximately 242% more than Medicaid. Restorative, 57% more. Endodontics, 81%. Parodontics, 78%. Prosthodontics, 12%. Oral surgery is 21%, and then general services, which we only have one code underneath that, is 20%. So,
Chandra, can we get that information in the minutes? So we can-
absolutely.
okay.
And then I will go ahead and send you guys, I actually created a spreadsheet that lists everything individually, and I will send that to all of you guys. Do you have it?
Yeah, you said it was attached.
Oh, okay.
Just
Sorry.
to you.
Just to you.
You're special.
Everything.
So I will go ahead and resend that out to everybody.
Another consideration with aligning more with Medicaid, we might not get the providers throughout the state. So it's a consideration. I remember when we were talking about the immediate denture conversation, and one thing that was brought up was, should we be covering something that Medicaid doesn't cover? Because the only reason why people are getting this program is because they're over resources or over income for Medicaid. So we're essentially treating the programs disparately in terms of, if you have resources, we're going to pay for more than if you don't have resources.
Yeah, you're definitely walking on a line there, because, you know, a lot of them want to be on this because we pay more than Medicaid. Other people don't want to be on this because the 7% doesn't pay enough for them to do all the paperwork involved, which Joan, since you do the paperwork.
Yeah, it's a lot of paperwork. We never take the 7%. We keep it all for our patients, but just.
And there's a few of the providers that do that, but so yeah, it's a fine line, and I think this is one that we're going to wind up having a lot of grantee input, which I think it will be great to have with the stakeholders coming forward and letting us know their thoughts. But you start looking at these averages, you know, JBC was told 81%, but you look at this, we have some that's 242% more. So.
And it's interesting, the one thing a lot of the seniors really need is the prosthodontic and the denture part.
Mm-hmm.
Need that as much, if not more, than the preventive almost.
If you have the Medicaid benefit, you have the Medicaid capping, you would then be able to, I mean, a denture under Medicaid, if you have more than 9 teeth, someone has to give you the extractions to get to the denture.
School that in order to get to a denture under Medicaid, if a patient has 8, 9 teeth, to do the exodontia, to do an exam, that caps out that $1,000 under Medicaid. So in the school, we often give away tooth extractions to get to the denture because that's our teaching need. And so it does, if you could somehow drop the fee structure to Medicaid, not cap it at $1,000, it would still be an extraordinary benefit to someone beyond Medicaid, but it would then allow the care to flow. Because we also have people who do serial tooth extraction. You know, this benefit year, we take out teeth X, Y, and Z. The next benefit year, we take out A, B, and C, and then move down the path that way. So, I mean, I think we're outed right now. I mean, the Joint Budget Committee now understands that we're providing a higher benefit than Medicaid. I doubt if that would sit very well. It wouldn't sit very well with me if I were sitting on that committee. The other part of it is I kind of think that, didn't this legislation get enacted before there was any adult Medicaid benefit in the state? Didn't that happen?
That I do not know. I'd have to check.
Yeah, because the adult Medicaid benefit only happened 2-3 years ago.
Well, this one, but the OAP was going previously, and that.
OAP has been going on for over 10, 15 years, but it wasn't funded for a period of time.
But did the fee schedule, or did the legislation that enacted this and kind of tagged this one fee schedule as you can't reduce the fees, was that done in a little bit of a vacuum, not understanding what the Medicaid rates were going to be into the future, And now if you went to Senator Kefauver and said, here are these two fee schedules, does this sit well with you? I would kind of imagine that it wouldn't.
See, and I would have to ask on that since I wasn't involved with this. I know Nancy was and CGS had some involvement in it. But I'm almost wondering, and I could be wrong, but I'm wondering if the ensuring that they didn't change had to do with the grantees and stating we want to make sure we don't lose the money that we're already receiving.
Mhm.
I could be wrong, but
I'm not sure, but I think that when it was.
Do you want to come up here and talk?
Sure. No, I'm not.
Introduce yourself.
Is this on? Or?
It is on.
Okay. So I'm Bernie Schmeitz. I'm with the Colorado Gerontological Society Senior Answers and Services. This is what I think happened. I'm not 100%. But when it was old age pension, before you guys took over, and I don't think they had to go through through like a bill, because I believe at one time when it was under the old age pension, under that form, when the 4 million first came up, it was, I think they adjusted the fees because a lot of that adjustment went to like x-rays and the consult at first. And our dentists that worked with our program said, wait a minute, why are you paying all this money? Because an x-ray is 4 cents. What are you doing? And that was a huge expansion of how much this program paid. So, but that's my recollection. So,
And for years, it's like 500,000 was the total for the old age pension dental. The irony is the old age pension individuals aren't eligible for this program in general because they're receiving Medicaid. So when it became the low income dental program, the income standards changed to where Medicaid covers Medicaid and we cover people that are just not quite eligible or not eligible for Medicaid.
correct. And which is, and the big thing that we're looking at now, as you all know, because it's going to start getting serious with the baby boomers getting older. Thank you, Bernie.
sure. Thanks.
Baby boomers getting older, our seniors are just going to keep increasing. And a majority of the seniors, once they turn 65, they're booted off Medicaid. They're no longer have any type of dental. So that right there is another thing to start looking at. So I definitely will take this forward and see what needs to happen to have those reduced. It's something that's not going to be that's going to be done quickly because number one, we're going to have a lot of stakeholder involvement. It'll have to be a new bill that's done to have those changed. So, but one thing I do find interesting, you're talking about the cap. Medicaid, they have the cap that they use that doesn't include the dentures, but yet our averages right now, including dentures, are around $1,000. So it's really it's quite interesting how that works out. So.
Do you know what the approximate total Medicaid expenditures are for the adult dental?
I do not.
Okay.
Do not. In fact, I just got a hold of our director over there saying we need to get, since Alan's left, we need to get somebody else on this committee so we can answer questions just like that. So.
Because I think when this program went up to $3 million, that's when it changed substantially in terms of how it operated, and this committee was formed, and it's a lot more substantial.
So, okay.
Chandra, this is Whitney.
Yes.
I have a quick question. So as we come closer to the end of this fiscal year, would it be possible, and is it, I don't know, if it's hugely inconvenient, I don't need the data, but would it be possible to get a number of how many clients from Wells County got served by the program? Because I have so many clients that would have to commute to be able to utilize the resource. And for the other counties that don't have grantees that are right there with them, Because I know we have a couple in Weld County, but they can only serve parts of the county because they're with the Salud Clinic. And Salud
Right.
will only take people from certain areas.
And
But a lot of folks from Greeley that I tried to tell to go to Denver, but I don't know if they did or not.
what I can do.
So that number would be helpful.
Unfortunately, one thing that we need to discuss about is, on our invoices, we have a portion where the grantee enters a zip code. That zip code is where the grantee is located and not the client. So
we don't have a way to track it right now.
right.
Yeah.
So, I mean, it's something that if that's data that the DAC would like to see in the future, that's something we would need to add to the invoice.
If it's possible, that would be hugely helpful for me because I could advocate to providers closer, like somebody here in Greeley saying, hey, these are how many people are traveling from Greeley to somewhere else that could be your clients if you consider applying. Because I tried to convince one of our clinics here in town to apply in Greeley and had no luck this year. So I'd love to try again with some data to back me up.
Okay. That's something that we will bring up. We're actually revamping the invoice now. So that is something that I can look at adding. The other thing I wanted to let you know as far as like the Salud clinics, another change that I made to that list is I know with Salud, they have to be in a certain area. Even though they're located in the county, they have to be within a certain area to be seen. All the names of those areas have now been added to that sheet.
Oh, that's awesome. That's really helpful for
So you
my
guys,
clients.
you guys will be able to know right away if the client can be seen.
Thank you for doing that. That's great.
You bet.
We can, at the school, we can query our database by zip. I've done it to look at our grant, the people that we're serving and see how broad reaching we are. And we're pretty broad reaching in the state.
Mhm.
We're outside of the 2 counties that involve Aurora. So.
The other thing, if you get to zip codes, you can get to census tracts, and then you can get down to the granular level of what's the income level for this area of the community and identify if these people are most in need.
That's something I definitely can do. I can go ahead and add that zip code, and it's not something that's going to be difficult for the grantees because that's information they have right in front of them anyway.
Mhm.
So, all right, plan on that being added then. That's not a problem. All right.
Anything else? Any public comment after the last conversation?
I just want to maybe correct myself on that. It might have been, Bernie with the Colorado Gerontological Society, it might have been, we had the dental program before the adult dental Medicaid through Dr. Cobb. And so we had gone out and kind of did our own, how much we were going to pay. So it might have been from that to when it came into the OAP where that money went up.
That
So it
could
might
be.
have been that time.
Could be.
And I know some of our dentists said, what are you doing? It's like, well, it's not up to us anymore. But thank you very much.
Thank you.
Thank you.
Any other comments? Motion to adjourn? All right. Well, thank you all.
All right. Thank you, everybody.
I was just driving along and all of a sudden I'm beside this park and says, you've arrived. I go,
Nice.
no.
That's a nice day, man. It's trying to-
I know, I'm on Grant and I'm thinking like, I know it's right off of, this is right there, but, and so I had to call my wife because they didn't have, the email had been erased off my phone to get the real address. She was not happy, so I said, I'm never in this part of town, so.
Great. Yeah,
That was
thanks.
easy.
See ya.
So where,
So Glenn, I believe you need to meet Tracy.
Hey, but I mean, with the amount of construction going on around here, it feels like you're driving
actually,
to Colorado Springs.
the drive up was for a change, not a hassle. Luckily, I was like
Thank you, ladies.